Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the pharmacology of the potassium-sparing diuretics. The most commonly used potassium-sparing diuretic is the spironolactone. It inhibits sodium reabsorption and potassium excretion in the collecting tubule. It may be used alone when aldosterone is present in excess. It is often used with thiazide diuretic in the management of hypertension. So look at that, if we look at that, okay, so this is the image of a nephron. This is the Bowman's capsule, glomerulus, efferent vessel, the proximal convoluted tubule, the loop of Henle. This is the descending limb, thick ascending limb. This is the distal convoluted tubule. This is the collecting tubule or collecting duct. And this is the site of action of the potassium sparing diuretics. It works on the epithelial lining of the collecting duct. So what is the mechanism of action? The spironolactone is a synthetic steroid. It antagonizes aldosterone at the intracellular cytoplasmic receptor site. It prevents the target cell nucleus to produce protein in response to aldosterone. So the nucleus is not producing messenger RNA. Messenger RNA, if it is not produced, it will not go to the rough endoplasmic reticulum to produce the protein, and that protein is very essential for the reabsorption of the sodium and excretion of the potassium. So sodium potassium exchange at the collecting duct does not take place. Potassium and hydrogens are not secreted in the collecting duct. So hydrogen will remain in our system, that will lead to acidosis. Potassium will remain in our system if it is excess, that may lead to hyperkalemia. The effect of spironolactone depends on renal prostaglandin synthesis. So if we use the prostaglandin inhibitor like NSAID, then the efficacy of the potassium sparing diuretic will be lost. So what are the effects? It increases urinary excretion of sodium and increases volume of urine, and it is a diuretic. It decreases urinary excretion of potassium. What are the therapeutic uses? It is a diuretic. It is not as strong as that of the loop diuretic, but it is still a good diuretic. It is used to manage hyperaldosteronism, that may be secondary hyperaldosteronism, or it may be primary hyperaldosteronism. Secondary hyperaldosteronism, like that of nephrotic syndrome, heart failure, cirrhosis of liver, may be due to renal artery stenosis. Primary hyperaldosteronism, like that of Crohn's disease, or any other tumor developed in our body that produces too much aldosterone. Aldosterone is a hormone that is coming out of the adrenal cortex from the zona glomerulosa of the adrenal cortex. That is a mineralocorticoid. So this is the drug, the spironolactone and other potassium-sparing diuretics are useful in the management of heart failure. In heart failure, heart cannot pump blood properly. There may be stagnation of fluid, so we need this medication to get rid of excess fluid from our system. Pharmacokinetics. Spironolactone is absorbed orally. This drug, spironolactone, is absorbed totally and is bound to protein. It is strongly bound to the protein and converted into canrenone. So canrenone is the is the product of spironolactone. That is the most active product of the spironolactone. Canrenone has mineralocorticoid blocking activity. Spironolactone induces hepatic cytochrome P450. This is the enzyme system used by many other drugs for their metabolism. So drug interaction is very important in the therapeutics of the potassium-sparing diuretics. Adverse effects of the potassium-sparing diuretics. Peptic ulcer. There may be erosion of the gastric mucosa, duodenal mucosa, even there may be some ulcer and hemorrhage. Gastric upset that may lead to diarrhea, that is a possibility. Metabolic acidosis. Why this happen? Because hydrogen ion cannot be excreted in the collecting duct because sodium is not reabsorbed. So sodium, if it is not reabsorbed, potassium cannot be excreted. The hydrogen cannot be excreted. Hydrogen will remain in our system, may lead to hyperchloremic metabolic acidosis. Gynecomastia in male. What is gynecomastia? Enlargement of breast in the male individual. Okay. Menstrual irregularities in female because it is a medication, it is a steroid, synthetic steroid. It will work on the activity of other steroids. It may lead to hirsutism. What is hirsutism? That is the growth of hairs in the unsightly places. Suppose a woman develops, she has grown the mustache or the beard. Okay, so that is hirsutism. Impotence, that is the problem of maintenance of erection during sexual activity. Loss of libido. So these are the adverse effects of the spironolactone. Okay, so we have other potassium sparing diuretics like that of the trantaron and amiloride. So how can you remember the name of the potassium sparing diuretics? If you remember the word stat, okay, then we can remember that, or stay, that means potassium should stay in our system. These are potassium sparing diuretics. We don't like to lose the potassium. Potassium is staying in our system. So STA, we'll forget the Y part. S means spironolactone. T stands for the triamtaron and A stands for amiloride. These are the commonly used potassium sparing diuretics. The FDA has also approved some other potassium sparing diuretics. So how about these two potassium sparing diuretics, triamtaron and amiloride? They does not depend on aldosterone. So where they work? They work on the sodium channel. Where? They work on the sodium channel in the collecting duct. Exhibit diuretic activity even in individuals with addiction disease. What is addiction disease? Addiction disease is a disease when there is lack of mineralocorticoid like aldosterone. This is a condition of hypoadrenal cortex function. Okay, so hypoaldosteronism. Okay, that is the addiction disease. So these two drugs will work even in a patient with addiction disease, but the spironolactone cannot work in a patient with addition disease because spironolactone is a mineralocorticoid antagonist. If there is no mineralocorticoid, then that does not work. The spironolactone cannot work. But the tramtron amiloride can work even in a patient with addition disease who has the lack of mineralocorticoid. So, adverse effects of tramtron and amiloride include leg cramp, high blood urea nitrogen, hyperuricemia, and hyperkalemia. Hyperuricemia because there will be excess of uric acid in our body. So it will because the diuretic compete with that of the uric acid for excretion. Okay, so there will be hyperuricemia that may lead to gout also. So there may be deposition of the uric acid crystal in the metatarsophlangeal joint, in the knee joint, or elsewhere in other joints. Okay, and hyperkalemia, calcium, our potassium, not calcium, potassium level should be 3 to 5 milliuq per liter. If it is more than 5 milliuq per liter, we say it is a case of hyperkalemia. Okay, so in case of tramtan amiloride and also in spironolactone, there is possibility of hyperkalemia. Kidney stone, especially with that of the tramtaron, because tramtaron is less soluble, it may be precipitated, so it may lead to kidney stone and there may be chance of renal failure. Okay, we must know the drug interactions. Addition to another potassium sparing diuretic is a no, that will lead to hyperkalemia. NSAID should not be taken simultaneously because both of them use the prostaglandin. This is prostaglandin inhibitor. Our diuretic need prostaglandin, so it will not go hand to hand. AC inhibitor will alter the renin-angiotensin-aldosterone system. Erythromycin is an antibiotic that also uses the hepatic P450 system, like fluconazole use the same hepatic enzyme system. Diltiazem, calcium channel blocker, antiarrhythmic drug that also cause drug interaction with that of the potassium sparing diuretics. Contraindication. What are the contraindications? Hyperkalemia. So never two potassium sparing diuretics together. And person who is taking potassium sparing diuretics should not take additional or exogenous potassium like that of potassium rich food like that of the banana or the green coconut or the citrus fruit should be regulated, should not be too much. That may increase the potassium, may lead to hyperkalemia. And renal insufficiency is a contraindication. Okay, and also we may add also the liver damage. Although this is a drug for liver cirrhosis, but in end stage when the liver is totally damaged or close to damage totally, in that condition, this is contraindicated. Also, we must concern about the drug interaction. When we apply multiple drugs, that may cause problem. Okay.